Can we have a mic over there?
Thank you very much for two interesting presentations. So my question is for Søren, and so one of the things that you're seeing in the data is this worsening of mental illness when the pandemic becomes more severe. So we've been trying to using our data to try to tease apart restrictions and the severity of the pandemic, and the pattern of data that we are finding is that there is some indication that it's the restrictions that drives the severity of the mental problems, whereas things actually seem to get a slightly better from the severity of the pandemic itself. But of course, it's difficult to tease apart these two factors. But I don't know whether you have any thoughts on whether that makes sense from your perspective.
A little bit. So. I didn't show data from that particular study here today, but we ran a survey also among our patients, asking them about the first lockdown. It was in retrospect, so not ideal again, but they said those who reported worsening during the first lockdown said that the main reason for that was not because they feared the pandemic. It was because of disruption of routines predominantly. That was the reason that stood out, and something that the clinicians reported as well. A lot of our patients, they rely on routines, as do we all, but they probably do so more than the majority of the population. They're very relying on particular things going on in the same order and so on and so forth. And when these routines were disrupted, they really felt bad. So and that would go well with the restriction explanation that you provide. So I think that is compatible with what we've seen. Yes.
I have a question for Thomas, which is sort of a personal note, so to speak. So my wife is a doctor and was working in a COVID ward for some part of the pandemic, and was not able to see her dad, who was very ill and unfortunately actually died. She only saw him a few times in this period because she was, of course, afraid of infecting him. So my question is, have you seen any data on how having close relatives who are maybe especially at risk affects healthcare workers' mental status or their mental health outcomes?
I'm not aware of data on this because it is a very sensitive problem, and each case is different. So it's not very good data to summarize and make analysis on. But I can go on for hours and telling anecdotes like this from my 2 months where I spent in the ICU, and it's sometimes dramatic impact on persons.
Thank you.
Another question down here, 3rd row.
Thank you. Also a question for Thomas. As a clinician, do you see any solution to this quandary that we have now where healthcare workers need to catch up on resting, but there's also a big catch up in terms of normal operations?
I think we were not very good prepared, even if we saw what is happening in China and if we saw what is happening in Italy, we were not very well prepared, and we were surprised by when the wave struck us. So even in February, we sent lots of protective material, which we had on stock, to China because they were in problems, in shortage. And then we, in March, we bought them back for the 5-fold price, Chinese products, because we had a shortage. So there was a little bit short-sighted, and we are always in the Netherlands, the ICU capacity is always almost 100% full, even without any pandemic. And this is a problem as compared to Germany, for example, which have only 50 to 60% ICU bed coverage, so they could very easily catch up with that patients and take them and open up more beds than the Netherlands, which is on the maximum level of the capacity in normal times. So there's a lot to learn. But I'm sure that when the next pandemic comes, we will still be surprised and we will still be not prepared well enough, I'm afraid.
Okay, I think there's room for one last question and we'll go on a break.
Thank you. Now I'm just wondering if about the healthcare workers' really terrible mental health risk. What is the flavor of this now, like in places where you have a big wave again, like in the US states, and you have overfilled hospitals and everybody who's in there are non-vaccinated? Does this get a new flavor now that actually people choose to not protect themselves and then risk the healthcare workers' mental health? Regardless, do these things get linked together in your mind?
Not yet. I think it was you who asked this question in the first session. So these data are not made public, but it's the same. We have now 5 patients in our hospital, and all of them are not vaccinated. So it's this population that we see now in the ICU. So if this data should be made more publicly available, I think this would help reconsider for some people in the population. But I learned that this data are coming next week. Next week. Voila. Very good. Looking forward to